All right, so to open the oral cavity, you want to take your scissors and go in through the corner of the mouth. Watch out for the little teeth, so I keep my fingers at the very end. Open the mouth slightly, it may be tight, and you're just going to keep cutting back. It's kind of thick. Don't worry about cutting into anything. Those are structures we're not going to worry about. It will get tough when you get underneath the eye. This is the cartilage that you're cutting through of the mandible, the lower jaw, as it connects with the upper jaw. You want to go back as far as you can cut. The farther back you go, the easier it will be to open up the mouth. Okay, and we're going to flip this over and do it on the other side. Can be very tough. And again, you'll be just under the eye, and you want to go as far back as you can go. Okay. To open the oral cavity, the easiest way I've found is to put your thumb in the end of the mouth here. Watch out for those little teeth. Your other thumb over here, and just pull. And you will, chances are that's not open enough because you need to find the epiglottis in there, so you'll have to make some more cuts. Again, cutting through this masseter muscle in the side and over on this side. And then just keep pulling open. Sometimes it helps if you sit your pig up. Again, watch out for those teeth. It can rip holes in your gloves. Okay.